in.
Hi, my name is Mia. I'm going to be your nurse today, and I've provided the patient privacy, performed hand hygiene. Can you verify your name and date of birth?
Michael Thompson, 1961.
Okay, thank you. And do you have any allergies?
No, I don't.
Okay. I'm going to be performing a head-to-toe assessment today, if that's okay with you.
That'll be fine.
And I will have to touch you. Is that okay?
That's fine.
Okay. And are you in any pain today?
No.
Okay, good. So first I'm gonna just start from the top and go ahead and check inside your ears. Make sure there's no drainage or redness. Okay, looks good. And have you had any recent ear infections or drainage?
No.
Okay. And I'm gonna look in your nose. Any problems with nosebleeds or anything like that?
No.
Okay. And can you open your mouth and out your tongue? Okay, and everything looks good there. Have you had like a problem with like a sore throat or anything like that? Trouble swallowing?
No.
Okay. Next I'm gonna take a look at your eyes, so just look straight ahead. Okay. And just follow my pen. And I did turn out the lights for this, and your pupils are equal, round, responsive to light and accommodating to light, and they're about 3 millimeters, I would say. And have you had any trouble with your vision?
No.
Really? No? Okay. And next part of the kind of skin assessment, while I'm already here, I'm gonna just take a look in your scalp. Is that okay?
Yeah.
And have you noticed any lumps on your head, anything like that?
No.
How about any lesions?
No.
Okay. And now I'm going to take a look at your skin, and there's even hair distribution on both your arms and your legs. Can you tell me about this cut?
I just tripped and fell one time.
Okay. And I also have felt with the back of my hands for temperature. It's even, and it's not cold. It's about room temperature, which is good. And let me take a look at your fingers. So your fingers, I don't see any clubbing, which would mean like impaired circulation or low oxygen, something like that. And capillary refill is less than 2 seconds. Okay, so that is good. And I also haven't noticed any erythema or anything like that, any redness of the skin. Okay. Next I'm gonna take a listen to your heart. Before I start with that, have you had any shortness of breath, anything like that?
No.
Okay. Okay, and the points I've listened to, this is the pulmonic, and then this is the aortic, pulmonic, herbs, tricuspid, and mitral valves. And I heard S1 and S2 sounds, and no S3 or S4, which would suggest like heart failure or previous history of hypertension, and no murmurs were heard either. So as part of the cardiovascular assessment, I'm gonna feel each of at least 4 pulses to make sure they're the same on each side, so there's no sounds with the strength. Okay, you have bilateral symmetry and strength, about a 2+, which is normal, not too strong or too low. And for also, this is the axillary pulse is located here. You have the carotid up here, and then you have your popliteal, which is just below, behind the knee. We have one right here and here as well. And then you also have your femoral artery as well. So next I'm gonna listen to your lungs. Have you had any trouble with like a cough lately?
No.
Okay. And just nice deep breaths. Listen to your side. Listen to the side. Okay, listen to your back. Okay, everything sounds good. Next I was going to do a little education on like pulmonary hygiene. So using this incentive spirometer is really good at preventing pneumonia and keeping your lungs clear of mucus. So basically you just breathe in like you're breathing in a straw, hold it for 3 to 5 seconds, and then just exhale. So if you want to show that for me. And then breathe out. Okay, very good. And then also another good exercise is coughing and deep breathing. So basically just kind of like turning your head and doing a good nice cough and then taking a deep breath. And it helps kind of clear that mucus if you have any. Next I was gonna, for the neurological part of the exam, can you go ahead and just raise one hand for me? Okay. And just tilt, you can put it down, and tilt your head upwards. I'm gonna look at your trachea, make sure it's midline. Okay, it's good. And go ahead while I'm here, I'm gonna check for JVD, which is jugular vein distension. No, see anything on either side. And have you noticed any, had any like headaches or anything recently?
No.
Okay. And based on just what I've done so far, I can say that he's, according to the Glasgow Coma Scale, he is not in a coma because he can respond to like verbal commands and his eyes open spontaneously, and also he can like raise his hand for like response to motor skills. So also for part of the neurological exam, I need to do a few questions. Can you tell me what your name is?
Michael.
Okay, and where are you?
Macon.
And what year is it?
2023.
Okay, very good. So next I guess I'll start with the GI portion of the exam. So first I'm gonna listen to your stomach, but before I start, have you had any? Are you having any stomach pain?
No.
Okay. And just let me know if anything hurts. And next I'm going to use the bell to listen for any like bruise, which would suggest like a aneurysm or something affecting his arteries in his stomach. Next, I'm gonna just feel your stomach to see if there's any tenderness or anything like that. Okay, so next I'm gonna do like the musculoskeletal part of the exam. So just seeing that your joints and everything are doing okay. So have you had any recent fractures?
No.
Okay. So here, let me just feel here. So just go ahead and extend your arm. So just kind of pull it out and then just flex it. Okay. And so we're gonna do this again, and then just kind of push against me. Okay, very good. And then also like extend. Okay, very good. And also I'm going to check for your wrist strength, so, or mobility. And just go ahead, and that's flexing, and then extend, and then hyperextend. Okay. And just go ahead and flex again against me. Okay, and then extend, hyperextend. Okay, very good. Okay, so we're going to do the same thing on this side. So, and so I can feel for any crevice. Just go ahead and extend your arm, so just kind of pull it down and then flex it. Good. And then go ahead and flex it again against me. Okay. And then extend. Okay. Now we're going to do the same thing with your wrist. So flex is coming down like this, and then bring it back straight, and then hyperextend. Okay. And just go ahead and flex again, and then hyperextend. Strength is good in both of these upper extremities. So now we're going to check your lower extremities. So let's see. So I'm gonna have you like extend your leg, which is kind of like just bringing it out. Just bring it out. Okay, and then bring it back down. Okay, and then we're gonna do this again to see for strength. So just kind of push against me. Okay, and then bring it back down. Okay. And now we're going to do this with your foot. So you can just kind of extend it out, and then I want you to plantar flex, which is kind of pointing your toes down. Okay. And then I want you to dorsiflex, kind of pushing it up, and then go ahead and invert it. So turn it this way, and then bring it down this way. Okay, very good. We're going to do the same thing to check on this side. So go ahead and extend your leg, so just bring it out. A little cry for this, and then bring it back down. So, and then I'm gonna do it against my arm. So just bring it out, extend it, and then flex it. Very good. And now we're gonna check your foot. So plantar flex, so point down, and then dorsiflex, and then invert your leg. So point it in, and then point it out. Okay, very good. And let's see. Now we're gonna check your gait and balance. So we're just gonna kind of have you walk from here to this table, and just kind of put one foot in front of the other, like you're walking tightrope. And just try and keep your balance. You can, and now we're gonna see for balance, so go ahead and like bring your arms out and close your eyes. Okay, very good. You can sit back down. And also, let me go ahead and check for skin elasticity. So just making like sure it comes back to where it was when I pull it up. So that means you're like not dehydrated or anything like that. It's good. And overall, your skin integrity looks pretty well, and your everything, the skin color is, you know, even. And I forgot to ask earlier, but when was your last bowel movement?
This morning.
And are you having any trouble passing gas?
No.
Okay, and then for like the urination section, I wanted to ask you, have you had any trouble with urinating too much or too little, or urinating a lot at night?
No.
Okay, that sounds good. And also there's like, according to the Braden scale, there's 3 risk factors for skin breakdown, which are like excessive moisture can cause skin breakdown, not having mobility, so not being able to like walk around, being confined to your bed or like a chair, can cause pressure and like can cause pressure ulcers. Also, if you have like a sensory perception impairment, so people who have like dementia, Alzheimer's, also people who cannot feel as well, like who maybe have diabetes, mellitus, or spina bifida, something like that, are at risk for skin breakdown. I think and also, let's see, I think there's one other thing I needed to ask. Okay, I think the last thing I was gonna tell you about was safety. So keeping good lighting always helps prevent falls. Wearing grip socks is good at preventing like slips and falls. Keeping clutter out of the way when you're trying to like go to the bathroom is also a good habit to keep. And keeping like your things you need to get to, your like phone, stuff like that, is your water is good, so you don't have to unnecessarily get up and go get something. So also keeping your call light within reach is great. So if you need anything, you can always, you know, call me or whatever. And I think that's it. So if you need anything, give me a call.
Will do. Thank you.